Welcome, viewers and listeners, to the Health Revolution, the program that shows you how to have a life of vibrant well-being. In a world full of noisy health trends, we bring you clarity. In a sea of fads, we reveal the science-backed strategies that truly work. We explore physical strength, emotional resilience, and mental mastery. These are the keys to an enriched life. Join us for inspiring interviews with champions who conquered life's health challenges, fueling your journey. Are you ready to unlock your potential? To live with vitality and purpose? Then join the Health Revolution. I'm your host, Adriana Morrison, health and fitness expert, speaker, and a mom who understands. Let's embark on this transformative quest. Together, we're about to change the game, starting now. The information provided in this show is intended for educational and entertainment purposes only. Viewers should use their own discretion and consult with a healthcare professional for personalized guidance and recommendations. Welcome, everybody, to the Health Revolution. We're so excited that you're joining us today. I'm your host, Adriana Morrison, and no matter which way you are tuning into us, please do not forget to hit the subscribe button. We want to stay connected to you. Also, don't forget at the bottom of your screen, there's a little tab for show notes, and that's going to be extremely relevant for today's conversation that I'm excited we're going to have. Today, we're diving into how our health changes, especially as we age, and much especially for us women. Now, gentlemen who are watching, of course, you want to tune in because naturally you have loved ones, and then there's going to be relevant information that we are sharing. So our bodies are changing as we get older, and how do we adjust and how do we address those things, those areas in which are pertinent for us to be able to improve on? My next guest she is an amazing woman. She is an expert in her field, and we're going to get to know who she is and the receipts she brings to the table. First, check this out. Let's get to know her. Meet Dr. Soma Mandal, also known as Dr. Soma, a board-certified internist and women's health expert with a unique approach. With an MD from New York University School of Medicine and a research fellowship from Oxford University, she blends Western medicine with Eastern practices. Dr. Soma is also a speaker and media entrepreneur advocating for women's health and wellness. At Summit Health in Berkeley Heights, New Jersey, she focuses on preventative medicine, nutrition, and weight management, guiding women through menopause and midlife reinvention. Her mission? To empower women with knowledge and resources for a fabulous 40s and beyond. Recognized for her excellence, Dr. Soma has received numerous awards and accolades, including being named a top doctor in women's health. Today, she shares with us her holistic approach to health and wellness, especially as we become older. Dr. Soma, welcome to the show. How are you?
I'm well, thank you. Thanks so much for having me on your show.
I'm excited to talk to you. You definitely have a lot of knowledge, a lot of expertise, a lot of studies. And what led you to decide that this is an area of expertise you really, truly wanted to be a part of?
It didn't dawn on me until well into practicing medicine that I had a flair for, taking care of women. I think I had to mature myself and finish my training and then, kind of get my, hands wet a little bit. And then I noticed, and this was, in a practice that I started, it was, a number of years ago, where I noticed a lot of women who were gravitating towards me and, the care that I provided. And that's when I noticed that I really enjoyed, talking to women and understanding them and help guide them through all their different health issues.
As you were going through your studies, what was it like for you to, going through residency, and what were some of the things that you noticed that maybe were not being addressed in women's healthcare? I know this has been coming up lately, the dialogue and how doctors can continue to better guide patients. And what did you notice going through that maybe caught your attention, that we needed more emphasis on women's health?
Yep. I mean, yes, that definitely there was stuff back then, and unfortunately, there's still stuff now. And we need to really broaden the conversations. And as doctors, as healthcare practitioners, we need to be able to, have conversations that, sometimes are uncomfortable. And so back in residency, I noticed in different demographics of women that we weren't asking the questions of, is there a family history of heart disease? Have you been screened for heart disease? Some of the screenings wouldn't happen as early as needed for certain women. And so unfortunately, there were, disparities in health. And at this time, as someone who, considers herself a women's health specialist, even now, those issues still remain. I understand that there's a lot more awareness of hormone replacement and menopause and perimenopause, but you'd be surprised how many women come to me and say, well, I just saw so and so, but I'm still experiencing this, and it's very uncomfortable for me. What are my options? And it's still surprising to me that, those questions are sometimes brushed off as, well, this is a part of life and you just have to deal with it, when there are options available.
What kind of role did you find yourself playing as you were going through residency and then beyond, just establishing yourself in the medical field? Like how did you find yourself using your voice and having and being a part of some of those conversations in the medical space?
So, my journey in terms of, speaking, public speaking, or, doing media, writing, stemmed from back in high school when I, was in a drama club. And being a true introvert, I would never have thought that I, had a voice like that. And that's when I discovered it. Unfortunately, well, as you can imagine, when you're in medical school and residency, you're deep into studying and taking care of people. And sometimes that voice is not as loud as, it should be. But after I finished my training, a few years after that, I started my own practice, and it was kind of like a grassroots thing. I was in Greenwich Village in Manhattan, pretty much like a block away from where I went to college. And I said to myself, I'm just going to walk around, go to different businesses, introduce myself, talk about what I, do, how I can help people, how I can help screen employees. And then that passion and love for talking to people and, doing public speaking, came back.
What was the feedback that you got when you first did that? Because that can be considered groundbreaking, that I'm just going to pound the pavement. I'm going to strike up those conversations. I'm going to let it be known that I'm here. I'm a part of the community. Here's how I can help. What was the feedback initially that you got, and where was the greatest amount of support that you noticed was coming your way?
It was interesting. There was a lot of like small companies who were really happy that, I just stopped by. I was willing to do things for free, just to promote myself and my practice. And they were like, no, well, we can pay you. And I was like, really? That was surprising. So I think because I was, very earnest in wanting to help, that came through. And they had me come back. They had me do lectures for their employees. And that's when I remembered how much I liked performing in a way that's honest and teaching people. I realized that I had to incorporate that as part of my practice.
Sometimes those in women in the medical space have had a catalyst of their own personal journey push them with the path of specialty
Right.
that they've decided to study. What was it about your personal journey that contributed to why you really wanted to study women's health and the areas that you were focusing on?
So, when I was in medical school and even in residency, nothing really grabbed me. I kind of went through it, with certain interests. But I think I needed more exposure and time to figure out, what it is that I wanted to do. And it wasn't until I had my own practice that I discovered that I really liked the medical aspects of, taking care of women. Now, a lot of people confuse, women's health, with GYN. And certainly, obviously, there are many aspects of women's health in gynecology. But what I was attracted to were all the various medical aspects, and that includes heart disease in women and how it differs than in men, depression, and things like osteoporosis, and all the different health issues that we encounter from puberty through menopause and then after. I think being a woman myself, being a daughter, being a wife, having kids, one of who's a girl, it's really important for me to delve into this aspect, not only to help other people, other women, but also to help myself and my family.
Where are there areas in women's health that maybe, aside from the hormonal imbalances and the greater focus that's happening today, are there areas that we in society don't realize are so important to prioritize that we're not doing it right now? Are there just those areas that are hot topics within the medical community that we've yet to understand the gravity of why we need to know more about our bodies as women?
I think there's a lot happening right now, and I'm constantly listening to podcasts and reading, and there's so much that's going on in the world of heart disease. So heart, that's what I focus on the most, the heart, in my practice, because you would be surprised how many women come into my practice and aren't aware that they're at higher risk for heart disease. They focus on their cholesterol numbers, but I have to often remind them, well, you have this family history, right? And that is a huge risk factor. So you can't just count on a normal cholesterol number and say, well, my cholesterol is fine, and I don't have any other risks. So it's a message that I have to deliver every day, several times a day, for screening for heart disease. And the heart and, all the different organs like our brain and our heart and our lungs are very closely connected. So the same things that put us at risk for heart disease also put us at risk for things like dementia.
Are there trends with the heart that we need to know about? Are there evolving trends that are really grabbing your attention, or is there an area
Mhm.
within heart disease trends that you're homing in on because it's something to not take your eyes off of?
So there's a score or a coronary artery score. And a lot of people, even though the test has been out, for a while now, aren't aware of it. And so I teach patients what this test is and why and when to get it. So you would be surprised how many women don't know that 5 years after menopause, they are at higher risk for heart disease. Our risk kind of equilibrates with men at that point. So let's say someone went through menopause at 48, I'm just picking an arbitrary number. Their risks are going to be the same as a man at around 53. And there, a lot of times I get asked, well, why am I, I don't understand why I'm getting screened when I'm only 53. And then I have to educate them as to why. Same thing in terms of reducing other risk factors like, blood sugar, diabetes, and cholesterol, and hypertension, and the importance of knowing the numbers and controlling those numbers as much as possible. In terms of hot topics, there are a lot of, in the next near future, there are a lot of different cholesterol medications that will be coming out, targeting certain aspects of cholesterol that make it more likely for certain people to have heart disease, to form plaque in their arteries. So these are all the topics that I like talking about with my patients to make them aware, to know what options that they have. And the key thing is prevention.
Can you talk a little bit about that test that, so roughly 5 years post, is there a standard protocol, or does it start with a conversation that, say, a woman has with her healthcare provider that she bring up to then explore and decide whether or not the test is appropriate?
It's basically a tailored approach. Now, as you can imagine, if I have like a 20-year-old woman who has a little high cholesterol, but is otherwise, healthy, and, I'm not going to be rushing to screen her for heart disease. So the tailored approach is a conversation that I have with patients. A lot of it is asking a lot of questions, delving into the family history, finding out what age their parents or siblings may have, shown in terms of either if they had a cardiac stent or if they had a heart attack, and basically figuring out, when is the best time to get them screened.
And so with regards to the environmental factor versus the genetics, the family history, are there certain predictable factors that come to play? I'm guessing that there's probably exceptions to the rule that a woman may not have a family history and suddenly she presents as a candidate for heart disease.
Right.
If you could speak a little bit more to
Right.
that.
Sure.
Yes.
So in addition to, like detective work, and getting a thorough family history, you also have to do the chemical tests as well. So you're checking their cholesterol. You're doing, in the case of women who may have high cholesterol or other risk factors like diabetes and hypertension, you may want to do special cholesterol tests to look and see if they have that sticky kind of cholesterol that likes to stick to our arteries and cause heart disease. You want to know certain inflammatory markers that indicate that that person has a higher risk of heart disease. So, there are even calculators that determine the 10-year risk of having a heart attack. But unfortunately, and they're based on trials that have been done, but for women, the risk based on those, calculators are often underestimated. So a lot of it comes from an instinct of, working with women and knowing, okay, this is the type of person who is at higher risk because she's a little overweight, her pressures are a little borderline, her blood sugars are a little borderline, so she may not fit the box, in terms of true hypertension and true diabetes, but all of those things actually put her at higher risk.
Wow, this is fascinating. We're going to continue the conversation first. We're going to take a break. Don't go anywhere. Don't go anywhere. We will be right back after this. Welcome back to Fit Bites with Adriana. Today, we're diving into a topic that's often overlooked but incredibly important for our health: lymphatic drainage. The lymphatic system is our body's natural detox system, helping to remove waste and toxins. So when it's not functioning properly, it can lead to swelling, fatigue, and a weakened immune system. So how can we support lymphatic drainage? Well, first, stay hydrated. Drinking plenty of water helps keep the lymph fluid moving. Next, get moving. So exercises, especially activities like walking or rebounding, stimulates lymph flow. Dry brushing is another great technique. Using a dry brush on your skin before showering helps stimulate the lymphatic system and remove dead skin cells. And don't forget about massage. Lymphatic drainage massage is a gentle technique that can help move lymph fluid and reduce swelling. Lastly, consider your food intake. Eating foods rich in antioxidants like berries and leafy greens can support lymphatic function. By incorporating these practices into your routine, you can support your lymphatic system and overall health. Stay tuned for more Fit Bites, and here's to a healthier you.
Welcome to E360 TV, the live streaming and on-demand destination for influential voices and enlightened audiences. We offer trending, grassroots, and purpose-driven content across a diverse range of interests. E360 TV is more than just watching programs. We offer the ability to interact with live shows connecting audiences to real, authentic influencers and storytellers while streaming to millions of devices. Real experiences. Raw conversations. One destination for it all. E360 TV.
Welcome back to the Health Revolution. Welcome back, everybody. My guest today, Dr. Soma. We are talking about up-leveling through midlife. She is a board-certified internist, and she's a women's health expert, all things women's health. And Dr. Soma, before the break, we were diving into the elements around heart disease and what you've noticed, your area of focus, and that's one area in which you definitely are active in treating patients. And one thing I'm curious about is, have there in recent research studies, are there any, how are we evolving in terms of addressing heart disease, in terms of medications, in terms of procedures? What are some of the maybe more exciting areas that we're seeing, that you've seen in recent years?
Well, there are some exciting things that are going to happen, where, some medications will be coming out, where again, it will be targeting the LDL cholesterol, and there's a certain protein called a lipoprotein A, and think of it as a Velcro on that LDL particle, the cholesterol, and it kind of just likes to stick on that artery. So there will be medications in the near future that will be targeting those kind of particles. And we may not see this in our lifetime, but there are clinical trials happening so that people who are prone to heart disease, whether it's because they build more cholesterol or for whatever reason, these medications are targeting certain genes so that people never develop, clogged arteries. And again, you and I may not benefit from that, but the next generation will. But that won't happen until, several years. So those are the exciting things that are happening.
How complex is cholesterol? Where to start with that when you're
Yeah.
addressing this with patients?
Yeah.
How complex are we talking when it comes to cholesterol?
Cholesterol is very complex, and um, the way I like to explain it is, what works for you may not work for me. I'll give you an example. Eggs. Are they good? Are they bad? Well, we know that eggs do have certain benefits to them. They have protein, they have they have choline, they have all sorts of things that are good for us. But if we eat too many of them, then our cholesterol may go up. But that doesn't apply to everyone. For example, if I eat too many eggs, and I've done some experiments with this, if I notice that I'm eating too many eggs and I have a blood test, I can see it where my cholesterol goes up. I control the eggs, the cholesterol comes down. But that isn't applicable towards everyone. So, it's a universal rule doesn't apply to everyone because we're all, even though we're human beings, our metabolisms are different. So it's really important to understand your own health and how your body reacts to things. Knowing if you're eating too many carbohydrates, if that increases your cholesterol. And basically the message that I'm trying to say is having a check every couple of years isn't enough. It's really important to have at least one physical a year with your primary care physician to keep an eye on those numbers. For certain people, it may be even 2 or 3 times a year where those numbers need to get checked.
Blood pressure. What role does blood pressure play in terms of deviation from normal patterns as we get older? So going in 40s, 50s, and then of course, menopause. Once we women enter menopause, what roles are you seeing it play in the entire landscape?
Naturally, as we get older, our arteries get a little harder and stiffer, and that can make our blood pressure go up. Similarly, with menopause, there are women who are at higher risk for hypertension, for increased blood pressure, as they go through menopause and after. So again, the take-home message for all of that is that it's really important to establish a partnership with your primary care physician to have, to know those numbers. If you have slightly elevated blood pressure readings, you may not necessarily need to be on medication, but it's not enough to have that checked just once a year.
And then the deviation between women's bodies and men's bodies. Have you noticed or have you seen a huge deviation? And I know obviously menopause will just add plot twist to our journey. But what can you share with us that is important to know the difference between the two, between men's bodies and women's bodies?
Estrogen protects us. We're at lesser risk, through a portion of our lives. But once that starts to decrease, as I mentioned, 5 years, it takes a little bit of time. 5 years after menopause, we're kind of on that same level of risk as men are.
And when it comes to menopause and even perimenopause, how are you noticing the dialogue evolve within, say, as you are talking with colleagues, and then maybe the subject comes up or the concern, and then and just what you're hearing from patients, maybe new patients who've discovered you or patients who've been with you for a time. What does the dialogue look like?
So, when I was back in residency, I remember, this kind of mentality when, Women's Health Initiative results came out and everyone was like, okay, we can't prescribe hormones for anyone. And I was like, okay, that seems a bit extreme, Now we understand that there were, certain flaws in that study, the type of estrogen that was being used, and the age of the women that were being studied were older. So we can't necessarily extrapolate everything from that result. I feel like we're on this other path where it's good that there's a lot more awareness of some of the challenges of going through perimenopause and menopause. But now I often feel that women automatically think, like, as they go through it, that everyone should be on hormone replacement, whereas that's not the case. It should really be a tailored approach, with a one-on-one dialogue with your physician, to find out, obviously, if you're experiencing any issues, if it's worth getting the treatment, understanding the risks and benefits of that, understanding potential side effects of the medication, and understanding the limits of how long you would be on the medication itself.
What are some of your favorite or go-to verbiage to approach talking about this with a healthcare provider, with a physician? I know that I've had conversations with women, especially over the last year, where sometimes they feel that it's really hard to talk to their doctor, or that maybe that, there are certain experiences specifically where a woman has shared that her particular doctor just didn't take seriously her concerns. What are some verbiage that you can think of that would help those women out there use their voice a little bit more, so that they're clear in trying to address this with their doctor?
I think as women, and I obviously include myself on this, whether it's menopause or anything else, often I think we need to be advocates for ourselves. And a lot of us are mothers and daughters, and we're professional women, and we've approached a lot of different things in life, and reached a certain maturity. And it's important to know when you're not being served the best in a certain way in terms of your health. So if you're not getting the answers that you're seeking, then I think it's important to either, try to have that dialogue with the person that's sitting in front of you. And then if you're not, you would have to still do some research and find out who else would be a better person to have that conversation with, not to allow yourself to get frustrated and say, well, nobody's listening to me. You have to kind of, be your own advocate, and find someone who will listen to you. And with that, it's important to kind of structure the questions and conversations. So whether it's through reading an article, on how to approach your primary care physician or gynecologist, have those questions ready, right? So you know what to ask. And don't be ashamed about, what you're experiencing, because these are physiologic things that, a lot of women go through. It's part of life. But if you're suffering from it, then there's no shame in talking about it.
So I'm curious, that being a physician, have you found moments in which you've had to have very careful conversations in the clinical space, not necessarily colleagues, but as you're navigating and throughout your professional career? Have there been moments where you've stood forward on behalf of women to say, let's look at this from a different angle. Let's rethink this. So I'm curious to see, have there been moments in your career in which, that was something that you felt led to share and just explain from a woman's standpoint, that, let's rethink this.
Right. Adriana, that's a daily journey that I travel on. And I always call myself, I'm a mere servant, to my patients and their needs. So, I took an oath, and, I decided to become a doctor and serve my patients in the best way as possible. And often that involves education and having uncomfortable conversations. But a lot of that brings awareness, because even when I meet resistance and patients don't want to get certain tests done, and then they find out, that yes, there is some heart disease, or, their sugars are higher than what they thought it was. I'm just giving examples. Then, the conversation opens up and the trust builds, because they realize, like, okay, this is someone who is advocating for me, who is trying to help me.
So I can only imagine the tightrope walk act that you may find yourself in often, of in the interest of with the time that you're having with patients, and then the amount of time that maybe patients need. How do you navigate through all of that in terms of how do you show up?
A lot of times it's just, knowing who the person is, and, being their doctor for however many years. Like, I don't necessarily need to look through their entire chart to know who they are. So it's just the relationship that we've built, through the years. Let's say they started with me when, they're 30 years old, and now they're 45, right? So I now know, okay, this is the time when we're going to have these types of conversations. So it's based on trust and longevity, in terms of, at least with my patients. But, before I even enter a patient's room, I have a list of my own questions as well. And they know this. So it's not just like, okay, did you get your, mammogram? Did you get this? It's having those more detailed conversations that allows me to take better care of them.
What would you say to the viewer watching that really recoils with going to the doctor? Say that there's a fear base. I think of a woman that I know that had just that was her stance until she had a medical emergency, and then things had changed. But it took that moment for her, in her case, to really open up her eyes. What would you say to those who who might be afraid to get ongoing care and to have routine checkups?
I certainly have, a few of those, and you try to build trust with them, I'm not the kind of physician that, pushes medications unless it's needed, absolutely needed. But, there is, we're blessed to have healthcare, as expensive as it is, where we can, get checked for various things. So there are times when, I will spend an entire 40 minutes with a patient, going over all those things and saying, I'm going to give you some time to think about it. And I'm going to ask you to do one or two things, like whatever you feel comfortable with, and then have her come back, right? And then go through it until, maybe it takes a year and a half to get everything done. But, I have a different approach to patients like that.
So that speaks my language, of course. We're going to take a quick commercial break. Stay put. Don't go anywhere. We will be right back after this. Thank you so much for watching The Health Revolution. Our show is growing, and it's all thanks to viewers like you. No matter how you found us, please hit the subscribe button so we can stay connected and continue to deliver amazing content to you.
Life is so fragile, and we're constantly reminded just how fragile life can be, especially when we or a loved one is told we have cancer. Cancer survivor myself, I can tell you, we still feel very alone in this journey.
There's a study that's been shown that patients who are socially isolated have a worse prognosis, have a worse outcome than patients who are socially interconnected.
Buddies for Life is a non-profit cancer support group for those whose life has been impacted by cancer. Humor, hope, heart, and hugs.
Humor, hope, heart, hugs, and a whole lot of love.
Share this with your friends and family and support this community in every way you can. No one should face cancer alone.
I am a chemo buddy for life.
We are a buddies network.
No one does cancer alone.
Be a buddy.
And we are all here for you as a community of love.
We are chemo buddies for life.
And if you've heard 3 words, you have cancer, for yourself or someone else, you belong with us at Chemo Buddies for Life.
Healing through connections.
And now we want to give special thanks to Biomed Mobile IV for sponsoring the health revolution. Biomed Mobile IV is Colorado's top mobile IV therapy service, servicing throughout the state of Colorado. They offer an array of vitamins and above and beyond safety preparation. Biomed Mobile IV, your dedication to health and wellness is exactly what our show is all about. And we thank you for your support. Welcome back to the Health Revolution. My guest today, Dr. Soma, board certified internist, women's health expert. And Dr. Soma, before the break, we were talking about guidelines that you have, especially when you are addressing patients that are apprehensive about getting care because of just any fear that maybe that they're struggling with. And it begs me to ask, what are some misconceptions when it comes to women's health, especially as we get older, that we still need to address, that it would be important to debunk those myths?
I think, one of the biggest, challenges is, the time of perimenopause and menopause, and kind of, understanding that, yes, there are a lot of hormonal fluctuations that put us at, greater risk for depression and anxiety and heart disease. But, we're often labeled as crazy. And that, I think it's derogatory. But, there's some real challenges that happen in our bodies. And it's a time that, we really should be supporting women who are going through this, not just physicians and nurse practitioners and physician assistants, but, their own families as well.
I brought this up before in the show to a couple of guests, and I'm going to throw this out there and get your take. I have a theory that women who are labeled a Karen, minus the extreme stories that we've heard on the news, but women who have been labeled Karen, the characteristics that they share happen to be oftentimes that they're older, that maybe they are, that they're at their wits' end, and they're just, the level of coping is a serious challenge. How much of a woman's journey through perimenopause and menopause could very well be the reason why someone doesn't understand and then just automatically labels her as a Karen?
Well, I think we can all have elements of being Karen, here and there, but, having some real moments, right? And I'm not talking about mistreating people and abusing people. That, does not fit in, but, having real moments of feeling down and anxious, right? And affecting your health, that in no way equates to being a Karen. So I'll tell you, yesterday I saw someone, and she felt badly because she felt that she had, yelled at my assistant, and my assistant assured me that she hadn't. But, someone could easily have said, okay, this is a Karen, but we quickly realized that she was having difficulty.
And then in thinking about that, I'm wondering that if a woman is having a harder time and that maybe it is hopefully supportingly pointed out that, hey, I recognize you're having a hard time, that would be an indicator to maybe to check in with healthcare providers. Or have you had conversations with women who they just shared like frustration, the mood swings, and that it just you're able to get deeper with what's going on with her?
Yes, I mean it's something that you frequently see within primary care medicine. Mood issues, and whether it's related to menopause or not. What I do tell patients though, that a lot of the times I can't just tease apart everything within 20 or 30 minutes. So we try to do as much as we can, and have that person come back. We might tailor a certain regimen for them, or even medication, and see if that helps, but have an ongoing follow-up so she doesn't get lost through the cracks.
So I have to ask this of you. How do you take care of you as you are taking care of so many others?
As I get older, as I age myself and being a working mom, I realize that it's really important to have boundaries. And that means boundaries in terms of how much you're working, boundaries of, setting time for all the important things in our life, which includes family and enjoying things that you like to do and things that give you joy. So these are the things that I focus on myself. I try to eat the healthiest that I can. I, try to, partake in activities that make me happy. And a lot of that centers around my family.
So I know that you wear several hats within the space. You've spoken in different arenas. You're an entrepreneur. You're an author. What are some of your favorite areas of conversation? Are there certain conferences that really speak to you? Are there certain events that just really draw you closer as you're continuing to pave the way as a clinician?
I really like to focus and talk about women who, like you just mentioned, right, wear many hats, because that can often take a toll on our health. So they may be in that sandwich generation, and coincidentally, they're at that same phase of life where, they're going through a hormonal transition. So basically kind of figuring out how to help these kind of women in those situations, give them more support, give them more outlets, give them more follow-up sessions so that they don't feel like they're totally lost.
Absolutely. We're going to take a quick commercial break. We're going to be right back. Don't go anywhere. We will be right back after this.
Hi, this is Clara Capano, your host for Women Winning Their Way, where we talk about how you can create success all on your terms. Join us Thursdays at 8 p.m. Eastern Standard Time on the Limelight Network here on E360 TV.
Welcome back to the Health Revolution. My guest today, Dr. Soma. She's a board certified internist. She's also a women's health expert. And before I got to ask you, I know we went to break just a second ago. Dr. Soma, what is the one thing you wish every patient knew before coming to see you?
That's a good question. I think, I would like them to know, who I am, right? Before, and the time that it has taken me to, get to where I am and how I approach healthcare in general. Because it's really important to me. I feel like I have developed an individual approach to my patients. Not to say that others' approaches are bad, or worse than mine. It's just my own approach. And so I do think that's what attracts certain patients to me. But that would be what I would want them to know.
And where can we find you on social media and on the internet?
I'm very active on Instagram. My handle is Dr. Soma Mandal, MD. You can also find me at my website, somamandalmd.com, where you can see all my different social handles.
Now, are you on Facebook as well?
I am, yes.
Okay. And any exciting events, upcoming moments for 2024 that you've got going on?
I have, a number of podcasts that I'll be on, so it's exciting. And then a few TV shows that I'll be appearing on in the near future. I'm, continuing to write. So these are the things that I'll be working on for 2024.
And that's fantastic. And one thing I do want to ask, are there any areas within your practice that let me back up. Where do you see the future of women's health going, and what are some things that you're noticing that are going to be happening in the near future for your field?
I think women's health will be exploding, right? Because, we, are better advocates, for our health. And if we're not, we should be. So, and not just that, we're advocates for our own families. So as I mentioned earlier, there are a lot of exciting things that are coming out in the world of medicine when it comes to heart health. And I'm keeping my fingers crossed when it comes to things like brain health and, everything else as it applies to women's health.
Absolutely. Dr. Soma Mandal, I appreciate you being here, your time, your energy, and your knowledge. Thank you so much for joining us today.
Thanks so much, Adriana. It was really a lot of fun speaking with you.
Yes. And for all our viewers, of course, you can find us on the internet at thehealthrevolutiontv.com. You can subscribe to our newsletter. You can also email us with any show ideas that you would love for us to cover, and we will certainly deliver on that. Upper left-hand corner, you're going to see our QR code. If that's easier for you to grab, go ahead and have a little picture of that. And then, as always, we are on E360 TV on the Achieve TV channel Tuesdays and Thursdays, every Tuesday and Thursday, 10 a.m. Pacific, 1 p.m. Eastern on a weekly basis. That's all the time that we have. Thank you so much for joining us. Until next time, take care. We will see you soon.